I think in the US, probably anybody below the age of 70 without major comorbidities would be considered transplant eligible. And by those comorbidities, we're primarily looking at ejection fraction greater than 50% and pulmonary function test FEV1, FVC over 50%. As we know, renal failure is a big part of myeloma. So fortunately, that is not an exclusion criteria. You can be even dialysis dependent and get a transplant. And I would just say also probably your performance status, like are you a fit patient walking in? I always tell all my patients, if you're gonna go to get a transplant, try to walk at least 30 minutes a day, because that means that when you leave the hospital, you'll be more fit and be able to take care of yourself. And if you're going into the transplant barely getting one block, it's hard to come out and be really robust. So, and I guess the other part of that whole discussion is in terms of who's transplant eligible. So below 70 who's healthy, that's easy. The question is, what do you do with those 70-plus-year-olds? And I think, to me, you can divide people into kind of two camps, and those are patients who have an excellent response to induction therapy and excellent tolerance. Those patients, if you're getting deep, durable responses, you could probably maintain those on some modified maintenance approach. On the other hand, if somebody really doesn't get a great response or has a lot of side effects, those patients I think really should be considered for transplant, because even though we would reduce the dose of the chemo, and then I think that's an important clarification, particularly for patients, the transplant is a little bit of a misnomer. It's really high-dose melphalan with stem cell rescue. And so for these older patients, we always reduce the melphalan dose for safety purposes. And so I do think that for patients over the age of 70, one of the differences in approaches is in younger patients, because of the emerging data of MRD negativity potentially allowing us to delay transplant, those patients you may collect and defer. But for over 70, whose health is going to get better with age? And if you're already over 70 and we're already reducing the dose of the melphalan for age, I really encourage those patients to not only collect but go to transplant rather than deferring it.